waterfall that is in series. So it falls like this. This is a cascade. This is the waterfall. So the water falls like this in steps. So write coagulation cascade. Now you've got intrinsic aspect, then you've got extrinsic pathway, intrinsic path, then you've got extrinsic pathway, and then you've got a common pathway. So this is the coagulation cascade. This is how the water falls. Yes, yes, this is the cascade. Waterfall, cascade. Waterfalls in steps. Oh. So one is the intrinsic pathway, the other one is the extrinsic pathway, and then the third one is the common pathway leading to clot formation. ये पानी छोड़ दो, इनकी और ले लो बल्कि। ये हो गया पूरा क्लास। So the intrinsic pathway activated 12 factor axon, 11 and activates it. This one axon, factor 9 and activates it, 9 axon, 8 and activates it. So they are sequentially activated. 12 axon, 11 activates it. It activates, it axon 9 activates and 8 is activated. Tissue factor axon along with calcium activates factor 7. It is all activated. These one axon factor 10 and activate it. They act on factor 5 activate. This one is thrombin, it's active thrombin, and this one is fibrinogen converted into fibrin, leading to clot, right? And factor number 13 is the clot stabilizing factor. So these are all clotting factors: 12, 11, 9, 8, 7. This is factor 3. 10, 5, 2, 1, 13. These are all the clotting factors. These are all called as clotting factors. This is the intrinsic pathway, called as intrinsic pathway. This is cascade. It acts on 11 activates it, it acts on 9 activates, acts on 8, so it is activating like this. So we call it as cascade waterfall in series, in steps. So this one is intrinsic, the other one is extrinsic, and this one is the common pathway leading to the formation of clot. This is clot stabilizing factor. Then the clot retracts, serum is exuded, serum goes out, serum goes out, oozes, and you've got a definitive clot. The clot retracts, serum oozes out, retracts to a definitive clot. So this is the clotting mechanism. Now you understand that C, factor number 2, 7, 9 and 10. They are formed in the liver. Remember, all except factor 8 are formed in liver. Out of these, factor number 2, 7, 9 and 10 are activated by vitamin K. So if I ask you, what is the importance of vitamin K? It speaks for itself. That vitamin K, the name of vitamin K is coagulation vitamin. So it explains itself. It helps in coagulation. And what is coagulation? Well, the formation of clot. The intrinsic pathway, 12, 11, 9, 8, and tissue factor, calcium factor 7. They all combine together to a common pathway that is comprised factor 10, 5, 2, 1. The clot is over there, then the stabilizing factor, fibrin stabilizing factor, this is called as fibrin stabilizing factor. Fibrin stabilizing factor, factor 13. Then the clot is formed, then it forms a definitive clot after serum oozes out. And serum, you know, is plasma minus fibrinogen. Serum is equal to plasma minus fibrinogen. Serum is plasma minus fibrinogen. This is serum. Because fibrinogen is involved in fibrin thread formation, clot stabilizing factor here. So serum is plasma minus fibrinogen. So this was about clotting factors. So where does the role of vitamin K come in? Well, you've got factor 2 again. Factor 2 from in 7, the Christmas factor, factor 9, the anti-hemophilic factor, and 10, the Stewart-Prower factor. This is the Christmas factor. It's also called Christmas factor. This is called anti-hemophilic hemophilia B factor. You know about Alexis, the son of Tsar II Nicholas, who was treated by the famous Rasputin, by whatever spiritual methods, and also captivating the queen. So, the famous Rasputin, because factor 9F is to hemophilia type B. Well, it was just that. And then you've got factor 10, that is called Stewart-Prober factor. So all these things, 2, 7, 9 and 10, they are activated by vitamin K. So vitamin K has the importance that it activates the factors. Which factors? It activates factors 2, 7, 9 and 10 factors. How would it activate them? By causing carboxylation. By causing carboxylation by causing gamma carboxylation of glutamate residues. Of 2, 7, 9, 10. What does vitamin K do? It causes gamma carboxylation of the glutamate amino acid, which is present in factors 2, 7, 9, 10. So it activates them, and so they take part and so they do the clotting. If vitamin K is deficient, well, 2, 7, 9 and 10, they are not working. So would coagulation take place? No. So vitamin K is a coagulation vitamin. If vitamin K is depleted, is not given. For example, a patient suffers from liver disease. Liver disease. Bile salts are not being formed. So, when the bile salts